I'm Dr. Azadeh Shirazi, a board-certified dermatologist and founder of AussieMD Skincare. I specialize in laser and cosmetic dermatology, and today I want to talk about how to choose the right laser treatment for your skin type and your skin concern. There are so many lasers and devices out there, and it can be very overwhelming for the consumer to decide what type of treatment they need, what laser would work best for their skin condition. So I thought I would give you an overview of lasers in general, what they do, what they treat, how to choose the right laser for you, and talk about the risks and complications. But before we get started, don't forget to hit the thumbs up, subscribe to my channel, and share this with a friend who might also find this very valuable. Okay, lasers 101. Let's first talk about what is a laser. By definition, a laser generates an intense beam of coherent monochromatic light. And this light targets different molecules in the skin and selectively removes them without destroying the structures around it. That's what makes lasers so sophisticated and so effective at treating so many different dermatology and skin conditions. For example, if you want to remove a brown spot, that laser beam is going to target melanin. In general, the shorter wavelengths of light are more specific for melanin. And also, depending on the wavelength of the light that the laser uses, that light can penetrate deep into the skin or more superficial in the skin. And that plays a role on who is a good candidate for that particular laser. For example, if you have darker skin, you're gonna have more melanin on the surface, and certain lasers and devices can be high risk for you because they are gonna target that surface melanin and potentially burn the skin. Other lasers target hemoglobin in the skin or water. These are commonly known as chromophores. The chromophores absorb this light, they generate heat, and that destroys the chromophore you're targeting. So in order to have the most effective, safest laser treatment, you really want to choose the person that is performing your laser, because there's a lot of science and in-depth knowledge of laser devices and technologies and how they interact with the skin that makes your treatment more effective and safer in the long run. It's really important to understand the physiology of the skin as well as how lasers interact with the tissue. So what are the different types of lasers? Well, we have lasers that use light to pass through the skin and target these different chromophores we talked about. And then there are lasers that actually affect the surface of the skin. So let's talk about the top 5 reasons to use lasers to rejuvenate the skin. Number 1 is sun damage. Sun damage causes brown pigmentation, commonly known as sunspots or brown blotches, as well as broken capillaries that give your skin a red, blotchy appearance. So you have lasers that target these brown spots and selectively remove them, and then you have lasers that also target hemoglobin in the blood vessels and selectively remove these broken capillaries. When you remove the brown and red discoloration, then your skin is gonna look more youthful, it's gonna look brighter, it's gonna look less weathered, and just overall cleaner. If this is something that you have, this discoloration and weathering, and you just want to be able to not wear a lot of makeup to hide these blotches, then devices like an IPL, a BBL, a V-beam laser are great treatments for you. Now, if you have darker skin tones, then you have to be really cautious as there's greater risk of potential complications like discoloration, burns, and things like that. You really have to be very cautious with darker skin. So let's talk about IPL, BBL. These are considered light devices and technically truly not lasers. They do a great job of targeting red and brown. Now, a lot of people think they'll just have one treatment and then in a week all my brown and red spots are gone. Wrong. You really need at least 3 to 5 sessions to get the skin clean. I usually tell people a good result is 60 to 80% improvement with the first session. The reason why all of them are not removed in that first session is because not all the broken capillaries are going to respond the first time, and then the brown spots they'll get lighter because brown spots, there's so much melanin in that spot that one session is only going to penetrate so deep into the skin and is not going to be able to remove all the melanin and all the skin layers. So every time you do it, it's going to remove a certain percentage of the melanin, and then the next time it's going to remove more and more. So if you're really looking for the best results, you're going to have to invest in 3 to 5 sessions. The V-beam laser is the gold standard for broken capillaries and redness. Some people tend to get a lot of flushing and blushing with those broken blood vessels, and that is really specific, a true laser for conditions like rosacea and sun damage. Number 2, skin texture and pores. So the next category of lasers would be resurfacing lasers. Resurfacing lasers do the best job at smoothing the skin surface and generating new healthy skin cells. As we age, we tend to accumulate, fine lines in the skin. The skin also tends to build up with all this dead skin cells on the outer layers that gives our complexion a dull appearance. So resurfacing lasers help brighten the complexion and remove that outer buildup of skin, and by doing that, they help smooth skin texture and help reduce the appearance of pores. I talk more about pores in this video. Most resurfacing lasers will target water in the skin, and because all our skin cells have water in them, we can control the depth and the energy, the density of how aggressive we want to be with resurfacing lasers. I tell people, look, we can do a chamomile tea version or a green tea version of a resurfacing laser. You're gonna see some improvement, but it may not get your deep, lines and wrinkles. Or we can do a double shot of espresso when we're really going deep into the skin layer and getting to the bottom of those deep lines and wrinkles and really smoothing out the skin. Now, the deeper you go, the denser the resurfacing, the more downtime, and certainly there are more risks involved with that. But in general, they do a great job at fine lines, texture, and skin brightening. So what are the different types of resurfacing lasers? Well, I like to break them down into 2 categories. We have the ablative resurfacing, which means that it actually affects the surface of the skin. And then we have the non-ablative resurfacing, and that actually passes through the top layer of the skin and resurfaces the skin from the deeper skin layer. And so let's first talk about ablative resurfacing. Ablative resurfacing are lasers like the CO2 laser, the erbium laser, whereas the non-ablative are lasers like Clear and Brilliant, which is considered a chamomile tea, a green tea version, a Fraxel laser, a halo laser. Halo laser is very similar to the Fraxel. It's a newer version of the Fraxel. It can combine the ablative and non-ablative technologies, but it's mostly non-ablative, and we can make it completely non-ablative. So what does that look like when we're talking about how the skin heals, and when would you choose one versus the other? So if you have really deep lines and really deep wrinkles, then I would suggest going for a fully ablative resurfacing. So when we're talking about ablatives, you can have a fully ablative treatment, or you can have what's called a fractionated ablative treatment. Fractionated ablative treatments, I love the profractional lasers. We use that for acne scars, for texture. People tend to heal faster with that because we're not treating the entire surface of the skin, we're only treating the skin in fractions. And for that reason, the skin regenerates faster. It also tends to be safer, particularly if you have darker skin tones or fragile skin types. The fractionated lasers tend to be better. Now, if you have a lot of texture change and you have a lot of deep lines, then a full ablative resurfacing will give you better results. But the downtime is 7 to 10 days where you're not in pain, but you will scare small children. We can almost sculpt the skin with this technology, and it's something that I have a deep passion for, that I love doing, is these deep resurfacing lasers. I call it the skin lift technique because they combine both CO2 and erbium laser for best results, but we can really take those valleys and those troughs and the mountains and the regularity in skin texture and really smooth it out. Plus, the resurfacing lasers help bring in fresh, new, healthy skin. The way I look at it, it's sort of like taking off the dead old skin and allowing for our bodies to regenerate healthier, new skin cells that is smoother and tighter. And because ablative resurfacing causes the skin to remain open, the recovery can be more intense. You're gonna have to use a protective healing balm on the surface of the skin until that new skin grows in. Whereas with the non-ablative technologies like the halo laser, the Fraxel, the Clear and Brilliance, you can just use a lotion. You don't have to protect that skin surface with a heavy balm because the light passes through and doesn't affect really the skin surface. What you do get though with the non-ablative resurfacing is you get a lot of swelling. You still get, these are called mens, these little black dots on the skin. And that's where the light penetrates deep into the skin layer to tighten the collagen and regenerate skin. It takes about a week to really come off, but with resurfacing lasers, the results continue to come in over a period of 2 to 3 months. So you get initial healing of the skin. If you're talking about, downtime, you're really looking between 3 to 7 days, depending on the intensity, and then another 2 to 3 months to see the final effect, especially with the deep resurfacing lasers, where we are really taking off that surface skin completely. The third type of laser hair removal. I have an entire video dedicated to this because there are really 3 ways to use light technologies to remove hair. One is a IPL or BBL device. The one we have in our office is called Forever Bare. That tends to be less painful, much faster treatment, so it's great for like legs, back. And then we have the Alex laser, which in my opinion is the most effective, but it can be more painful and it can take a little bit longer, the treatment time. And then we have the 1064, the YAG laser for hair removal, and that is the gold standard for dark skin tones. Because it penetrates deeper and doesn't affect the surface melanin, it's much safer for dark skin. Number 4, overall laser rejuvenation for the skin. And all lasers will stimulate collagen and they will help make the skin healthier and appear more fresh. So no matter what laser you choose, you will get just overall skin rejuvenation. Now there's been studies with the BBL laser, which has something called the Forever Young BBL. Forever Young BBL will target the different aspects of aging and is considered more of a maintenance treatment for just skin rejuvenation. And when they've taken skin samples of people that have had regular Forever Young BBLs over a span of years, they've noticed that that skin is associated with younger, more youthful skin markers relative to skin that's not treated. So there is some definite science behind the BBL treatments and the fact that they do help regenerate and make the skin youthful long term. And people always want to know, are the results permanent? The results are permanent, but our skin, our bodies are dynamic. We're not plastic, we're not static, we're constantly aging. And so even though the results are permanent, we go back to aging. And so there's some maintenance that's required. It's not like you're gonna come see me, you're gonna have one laser treatment or a session of lasers and then you never have to see me again because the results are permanent. We're all prone to certain aging marks on our skin. Some people tend to get a lot of broken capillaries as they age, but they don't really get brown spots. Some people get a lot of sunspots and age spots. And so depending on the genetics of your skin cells and your lifestyle, some people are really good with skincare and with staying out of the sun. It really varies on how often you have to get these treatments. In general, the deeper the laser treatment, the less frequently you will need to have it. Whereas the lighter the skin treatment, like a Clear and Brilliant is a really light resurfacing laser, you might have to do that, more often. And then the last category I'll touch on are dermatology skin conditions that we treat with lasers. Things like scars, birthmarks, skin growths. These can be effectively treated with lasers, and a lot of people don't know that. I'll see somebody with a birthmark they've lived with their entire life not realizing that we can treat them. Or we can treat growths in the skin, like these little cherry dots on the skin that are so common, and some people really despise them. They don't like having it on their skin. We can use a laser beam. It turns purple and goes away really nicely. Certain growths on the skin we can remove with a laser beam, like the erbium laser. We can also treat conditions like acne, rosacea with lasers. So rosacea gives people flushing, redness. It can also over time cause the skin to thicken, and lasers can help delay that progression or stop it from happening. And I love the V-beam laser for rosacea. It's very effective. So what should you do before your laser treatment? Well, number one is to stay out of the sun. And this is important depending on the type of laser, but in general, if you're looking for getting an IPL, a BBL, hair removal, rosacea treatment, the best thing you can do is for 2 to 4 weeks before your treatment, avoid the sun. And I mean hats, sunscreen for sure. Try to minimize your time outdoors, because just by wearing sunscreen doesn't necessarily mean you're not going to get some color on your skin. Because remember, melanin from the sun can interfere with your laser treatments. We can't go as intensely with some of the laser lights. So not only will your treatment be less effective, you're also putting yourself at risk of developing complications. Number two, start on a retinoid. We as dermatologists find that when the skin is retinized or on Retin-A, the skin cells renew more effectively. People tend to heal faster from lasers. They tend to get better results when their skin is retinized. And I usually recommend that you start a retinoid at least 6 weeks prior to particularly resurfacing lasers. But in general, retinoids really do help enhance your laser treatment. Same goes for exfoliating. That can also help enhance your laser results. And number three, be patient. A lot of times people come in, they think they're going to have a laser treatment and their results are going to be pretty much the next day or 2 days later. And that might be from all my TikTok videos or my Instagram videos that's like a 10-second video and then there's a before and after. That can be really misleading. It takes the skin at least 7 to 10 days of initial healing time, but then the skin continues to heal thereafter. So you really have to expect the skin to look worse for at least a week before it starts to look better. In general, it's really about 2 weeks for the initial healing, depending on the laser treatment. You gotta give yourself time. And the deeper, the more intense the laser, certainly the longer the recovery. So be prepared for downtime. You also want to avoid using your actives that week that you are recovering. In general, you want to use a special kit of products that's given to you by your laser doctor that's designed for healing and nourishing the skin for better results. And lastly, let's talk about complications, because even in the best of hands, even in the most trained, most experienced hands, there are real risks and real complications. One being discoloration, whether it's hyperpigmentation or hypopigmentation. And this can be a result of all types of lasers. It's more common with darker skin tones, but really it can happen to anyone. It's so important to communicate with your doctor. If you're in a lot of pain when you're having this laser procedure, if you're experiencing unusual reactions after your laser treatment, because a lot of times the doctor can intervene early on to prevent the complication from being, more serious and more long lasting. In general, we can treat hyperpigmentation that happens from lasers with bleaching creams. Hypopigmentation can be more difficult to treat because lasers cause inflammation in the skin and sometimes disrupt the skin barrier. You can have things like acne and breakouts after your laser treatment. That is important to communicate with your doctor if you are prone to acne. It can also cause flare-ups of certain skin conditions like vitiligo or psoriasis or cold sores. A lot of times lasers can trigger that herpes virus to come out onto the surface of the skin, so it's important to take antiviral medications or acne prescriptions if you are prone to these conditions. And other complications, blistering and scarring. It's an unfortunate complication. In the best of hands, it will be very, very minimal because they'll know things to avoid to prevent that from happening. But if too much heat is delivered to the skin and it's caught on the surface of the skin, it can cause a burn and it can cause a blister to occur. So you have to make sure you communicate anything that is out of the ordinary to your doctor right away so they can intervene and prevent the scarring from becoming worse. Generally, blisters can happen within 24 hours of your laser treatment and in some cases can lead to permanent scarring. And then lastly, infections. You know, when you get your skin treated, your skin might be open or it might be inflamed, and that puts it at greater risk of getting an infection. So you want to make sure that you are taking all the precautions to avoid infections because they can have devastating results. All right, guys, I hope that was helpful. Comment below, let me know if you have any questions. I'd love to hear from you. Don't forget to check out my other laser videos and my shorts. If you're on Instagram, follow me at Skin by Dr. Ozzy. Thanks for tuning in. I'll see you next week.